Is your brain functioning well? Or is there perhaps a little problem? Today, we will discuss the 6 signs of dementia that you should never ignore. Dementia affects over 55 million people worldwide, making it the leading cause of disability and dependency among the elderly and the 7th leading cause of death globally. You might think, oh, I'm young. But changes in brain neurons start decades before the first symptom appears. Therefore, stay alert. We will divide this video into 3 parts. The first part is about the 6 early signs of dementia that few people know about or realize are significant. In the second part, we will talk about the 10 classic symptoms of dementia. Could the forgetfulness you're experiencing be one of them? In the end, we will give tips on how you can prevent dementia in the future, or at least slow the disease's progression. We will also discuss the latest developments in the field and why many scientists are hopeful that there is light at the end of the tunnel and that we might be close to ending this terrible disease. If you or a family member is suffering from memory loss, it's worth watching until the end. But first, like the video because the more people like it, the more YouTube distributes it to the right people, including those who don't have access to doctors or hospitals. Also, share the video with your friends and family. Tell us, have you been forgetting things recently? Or do you have a family member or friend with dementia? Where in the world are you from? Write down below. Let's go. First of all, what is dementia? Dementia is a general term that refers to symptoms affecting a person's cognitive ability, such as learning new things, remembering past events, reasoning, paying attention, making decisions, solving problems, and performing daily tasks. The brain is where a person's identity is stored, who you were yesterday, who you are today, your personality, your likes and dislikes, and your skills. Dementia attacks the brain, deconstructing the person and making them lose their sense of self and reality. They don't just lose their keys, they lose their identity. Dementia is a neurodegenerative disease where neurons die at a faster rate than normal aging. Therefore, dementia is not part of normal aging. You can live past 100 years lucidly without losing your memory or track of things. There are several types of dementia, but the main one is Alzheimer's disease, accounting for about 60 to 70% of dementias. This is followed by vascular dementia, caused by blood flow problems to the brain, which accounts for around 20%. Then there is dementia with Lewy bodies, affecting about 10% of cases, including actor Robin Williams. Lastly, 5% of cases are due to frontotemporal dementia, also known as Pick's disease, which currently affects actor Bruce Willis. What are the 6 early signs you should watch out for that may indicate that you or a loved one is suffering from dementia? 6th sign: postural changes. Early postural changes of dementia can be difficult to detect because others may assume they are part of aging or related to muscle weakness. These changes can include an altered gait, such as walking with shorter or slower steps, dragging feet, coordination problems, becoming more hunched, or leaning to one side. 5th sign: changes in sensory organs. Patients with dementia may start to have sensory problems that family members do not notice. This includes issues with depth perception, spatial awareness, taste and smell changes, noise sensitivity, and hearing loss. A study published in The Lancet showed that hearing loss in middle age is associated with a higher risk of dementia and may be a significant modifiable risk factor for preventing dementia in the future. 4th sign: muscle strength problems. Dementia, especially Alzheimer's, is more common in women. Muscle strength is related to Alzheimer's. An Australian study found that women with weaker grip strength were twice as likely to develop dementia in the future. Frailty in elderly individuals increases the risk of dementia. 3rd sign: sleep problems. This can manifest as excessive daytime sleepiness, insomnia, fragmented sleep, nightmares, vivid or intense dreams, restless sleep syndrome, and involuntary movements during sleep. Poor sleep is both a symptom and a cause of dementia progression. 2nd sign: apathy or anhedonia. This early symptom manifests as a lack of motivation or interest in previously enjoyed activities. The person may withdraw from family events, company, and hobbies. Various psychiatric conditions can cause apathy, but in dementia, It results from neuronal death and changes in neurotransmitters that regulate emotions. First early sign: difficulty finding words. A person may have trouble finding the right words, sometimes substituting related but incorrect words. This difficulty, called aphasia, can also affect the recall of names, even of well-known people. Early detection of dementia allows for more effective treatment and improved quality of life. Now that you know the early signs and symptoms, let's move on to the more specific and advanced symptoms. 10 symptoms of dementia. 1. Short-term memory problems. They may remember events from long ago, but not what they had for breakfast. 2. Difficulty following conversations. They may forget recent information and interrupt others. 3. Mood or behavior changes. They may become irritable, agitated, or depressed. 4. Difficulty making decisions. They may have poor judgment and engage in risky behaviors. 5. Loss of sense of time. They may forget the date, year, or daily routines. 6. Repeating questions. They may repeatedly ask the same questions. 7. Disorientation. They may get lost in familiar places. 8. Putting objects in inappropriate places. They may place items in unusual locations. 9. Hallucinations. They may see, hear, smell, feel, or taste things that aren't real. 10. Urinary or fecal incontinence. They may lose control over their bladder or bowels. Causes of dementia. While there is a genetic component, lifestyle, diet, and environment significantly influence dementia development. Factors such as head trauma, stroke, chronic infections, circulatory problems, excessive alcohol and drug use, processed foods, and nutritional deficiencies all increase the risk. Preventing dementia. 1. Ensure cognitive reserve. Engage in educational and challenging activities. 2. Physical activity. Exercise regularly to maintain circulation and brain health. 3. Quit smoking. Smoking damages the brain and increases dementia risk. 4. Control blood pressure and cholesterol. Poor control increases dementia risk. 5. Lose weight if overweight. Visceral fat inflames the body and increases dementia risk. 6. Manage prediabetes or diabetes. Type 2 diabetes significantly increases the risk of Alzheimer's. 7. Improve sleep. Good sleep helps clear brain waste, reducing dementia risk. 8. Improve diet. Follow a Mediterranean or ketogenic diet for brain health. New developments. Recent advancements in dementia treatment are promising. 2 new drugs, Lecanemab and Donanemab, target the beta-amyloid protein, improving quality of life and reducing cognitive decline. While these are expensive, they may become more accessible in the future. Did you like the video? Remember to share it so more people have this knowledge. Subscribe and see you in the next video. Thank you very much.